Hi, my name is Kristen,
This is Matt.
and we are physical therapist assistant students at Carroll Community College. And today we will be talking about steppage gait, which is an abnormal gait that is characterized by increased hip flexion and knee flexion on the involved side. Steppage gait is used to accommodate for drop foot or decreased dorsiflexion during the swing phase of the gait cycle. The patient is unable to bring the toes up or dorsiflex when they are in the swing phase. If the patient does not increase the height of their step, they will drag their toes on the ground, which could cause a fall. Also, when the patient is decelerating swing phase, they will slap their foot down due to lack of eccentric control of the dorsiflexors.
Drop foot is caused by muscle weakness of the dorsiflexors or damage to the deep peroneal nerve which supplies the anterior tibialis, the extensor hallucis longus, and the extensor digitorum longus muscles of the anterior portion of the leg. Other causes for drop foot could be Guillain-Barré syndrome, multiple sclerosis, a herniated lumbar disc in the spinal cord, a spinal cord injury, nerve compression, and diseases such as muscular dystrophy or ALS and Go ahead. Ready.
Treatment for a steppage gait due to the drop foot would be to place the patient in an ankle-foot orthosis or an AFO, which will give support to the ankle and allow it to clear the floor when the patient is walking for a normal gait. The AFO doesn't allow the foot to drop when they are going into the swing phase and keeps the foot in a neutral position throughout the gait cycle.
A nerve stimulator can be used to stimulate the deep peroneal nerve, which is used to activate the dorsiflexors at the appropriate time of the gait cycle to eliminate the drop foot. Physical therapy is also important for a patient with drop foot because it will work on neuromuscular reeducation and strengthening of the dorsiflexors and proper gait technique with an AFO, splint, or other devices.
Another option would be surgery to decompress the peroneal nerve or the spinal cord. If the injury was chronic, they would consider fusing the ankle joint so there is no movement in that joint when walking and the drop foot does not occur.